Hey there, I know you're confused about what you need to do after you're diagnosed of diabetes by your doctor. Now, I understand the whole confusion, right? A lot of things are going through your mind and you don't know what to do. Now, relax, okay? In this video, I'll be sharing with you exactly what to do after you're diagnosed. What next? Okay? Now, I don't want you to get panicky about it. Okay? Diabetes is a condition that can happen. Okay? It's just like any other disease condition that can happen. Okay? So you need to know the things that you need to do after your doctor have diagnosed you. Alright? Now, the first thing you must do is to be open-minded. Okay? Now, be open-minded, not to everybody, because a lot of people out there are doing the wrong thing, right? Now, you need to be open-minded to other professionals. Okay? Now, the doctor will kickstart, the control of your blood sugar. The doctor will do the diagnosis. The doctor will, prescribe, the medication and all of that, right? That is the first step. Okay. After that, okay, there is a need for either the doctor to refer you to, somebody who will help you. Now, you need to be open-minded about this, okay? So don't be too cagey about your medication that you don't need other professionals to help you out, okay? Now, the doctor will tell you to maybe go and see a dietitian, or a nutrition educator or a diabetic educator who will help you, to know more about that condition, to help you do a lot of things. Okay, so you need to be open-minded about it. Okay, now you're not being open-minded to any other person. Okay, don't be open-minded to informations that you hear online or people in your family who are sharing things, who tell you to stop eating that, do this, drink this, all of those things. You must rid yourself of such kind of mindset. Okay? Now, you need to talk to the professionals, and they are the people who are in a better position to guide you properly. All right? That's the first thing you need to do. The second thing you need to do is that you need to take your medication seriously. Okay? You need to take your medication seriously. I tell you, you cannot play any games with your medication. I've heard people say that they don't need their medication, once they give you whatever they want to give you, that you don't need your medication. It's a lie. It's a lie. I understand that at some point during your management or control of blood sugar with your drug and your diet and all the lifestyle changes that comes with it. Okay, now at some point you may need to take your medication mildly. Okay, you may need to stay away from it so that it doesn't drop your sugar too low. I understand. Okay, but at no point should you jettison your medication for any other thing. Yes, I know why I'm saying this, because I'm in this business and I know a lot of people are deceived in this. People are told once you get our product, you don't need your medication. That is a fat lie. Anybody that is telling you that, the person does not want your interest. You must take your medication seriously, and also you must also go and see your doctor as often as possible. Okay? Now, the next thing you need to do is to get an educator. Okay? Get an educator. a diabetic educator, somebody who will hold you by the hand and help you, understand, the nitty-gritty of diabetes and help you know what works and what does not work. Now, this is one of the things I do as a profession. Okay, I help people control their blood sugar, as a professional dietitian, of course. This is one thing I do. We have a community where we always help people. What we do is that we educate you, we give you all the support that you need to help your diabetic journey a successful one. Yes, I know that a lot of people die out of ignorance. Anybody you see that died out of diabetes is because of ignorance, especially for type 2 diabetes. It's because the person is ignorant of what works. Okay, now you need to know that there is what works and what does not work. And when you talk to the professionals involved, right? Now, the professionals will tell you what works and what does not work. This is why you need a community, you need a support system, to guide you properly. This is what we do in our 30-day secret code program, right? What we do is to help you, bring down your sugar alongside the teachings and or the illustrations, the diet meal plan, all of those things we give you so that you will learn what works for you. Okay, it is what works for you that will help you. All right, we don't just give you and leave you. Okay, there are people who give you whatever they have as solutions and they leave you. We'll give it to you and we'll bring you into our community, into our support group, where we also stay there and guide you on how to do this. Okay, you will see the link, to contact me, if peradventure this is what you need. Okay, you need people who will guide you properly, who will give you a diet made for you, tailored diet. Okay, and who will teach you for 30 consecutive days. You're going to be getting teachings on how diabetes work, okay, on how you can control your blood sugar, on what actually works. And this person will stay with you and guide you on exactly what you need to do. Now, this is what you don't have to miss. Okay, so take this seriously, get education, and I tell you, it's going to be amazing. Right now, the next thing you need to do is to take your nutrition care seriously. A lot of people are joking with their diet, and the reason is because they've not understood the role of food in blood sugar. A lot of people who have died before now have died out of grave ignorance. It is not that their own diabetes was worse off. The reason is just because that the people that they met, okay, they were people that were listening to every other thing online. They were people that were, listening to their grandparents who tell them, okay, now you need to be taking only pills, for the rest of your life. There are people that were reading posts on Google, not knowing that the people that were posting those things are non-professionals, right? There were people that were listening to just the medical doctors on food. The medical doctors, mind you, they are very professional. Okay, when it comes to diagnosing and medication, they are very professional, in doing that. But when it comes to dieting, okay, it is not their core profession. Now, when you listen to a medical doctor is talking to you from a position of a limited access to some knowledge that are in depth. Okay, this is not to disagree with them. This is not to antagonize them. No, but this is what it is. Just like I don't know anything about medication, and I don't go about to give people advice advise or prescribe drugs to people who, have diabetes or whatever condition. Now, this is the same thing, the doctor is always talking from their own limited knowledge about diet. And so they are not the right people you should listen to. The nurse as well, this is not their core, profession. They may know one or two things around it, but it is better you go to a professional, the specialist, to take care of that. Okay, the same way I know a couple of medications, I know a couple of things about medicine, but I will not position myself in that capacity as to give you prescribe drug for you, diagnose you, or do all of those things. Okay, I will not do that. So I will only refer you to people. I have a lot of medical doctors who are my friends who also refer patients to me. Okay, so this is exactly what you must do. Take your nutrition care very seriously. Talk to a dietitian. Whatever they tell you to do exactly that. And by the way, talking to a dietitian, I am a dietitian, right? I am a professional dietitian, registered dietitian nutritionist, and I also help people, on my own to, help them understand what this condition is all about. So if you want to talk to me, if you want to connect with me, you can connect with us in our community. You can connect with me personally. You can send me a DM. I can, assist you with whatever it is that you want, whatever help you might need, to scale through this condition, right? So this is me trying to tell you that you can make it, okay? You can make it out of this condition. You can control it without having complication. And one of the things the dietitian do is to help you prevent complications. Okay, is to help you keep your sugar to a normal level, and then to help you avoid all forms of complications. And this the dietitian will do with the diet. Okay, there is a diet that is meant for you, and it's only when you are diagnosed nutritionally and you're given your own prescribed diet which is suitable for you, that is when you are able to scale through all of this. Okay, now this is not to make you to panic, this is not to attack any profession, this is just to give you a guide, a proper guide on what next you should do. Okay, I hope you've gotten value from this video. I hope you got what you needed. Okay, now what you need to do is to start taking action. Click on that link below, and if you've not subscribed to this channel, I'd like you to subscribe to this channel. Like this video, tell me what you think in the comment section below this video, and share this video so that more people will have access to it. The more you like it, the more chances that more people will have to see it. Thank you for listening. I appreciate you. Thank you. I'll see you next time. Bye for now.